Hi, I am Dr. Somasekhar Rao, Gastroenterologist and Hepatologist, Yashoda Hospitals, Hitec City. Today we will talk about most important topic called jaundice. What is jaundice exactly? Yellowish discoloration of your eyes, of your skin and urine. This is what we call as jaundice. And how do we diagnose this jaundice? We do a simple blood test called liver function test. In that, if your total bilirubin is more than 3, we diagnose as jaundice. So, there are multiple reasons for this jaundice. So, jaundice is a symptom, it is not a disease. Jaundice is a symptom like fever. So, it is a symptom where you find yellowish discoloration of eyes and urine. And the cause of this jaundice can be hundreds of reasons, and we need to identify the cause and then treat the cause for jaundice. Most of the time, causes of jaundice are always around the liver. So, if there is a problem, just before the bilirubin enters the liver, you can have jaundice. If there is a problem inside your liver and there is a problem with metabolization of bilirubin, you can have jaundice. If there is a problem in excretion of bilirubin into the intestine, you can have jaundice. So, we can divide this as something called pre-hepatic jaundice, hepatic jaundice and post-hepatic jaundice. So, there are multiple reasons for jaundice. So, what do we do? Most importantly, there is a feeling that jaundice is life threatening always. Is jaundice life threatening always? Definitely we can say no. There are various reasons where it can be a simple self-limiting jaundice where we may not require any treatment. Sometimes it can be a very severe problem where you have to intervene and start treatment. It can be medical management, it can be endoscopic management, or sometimes it can be a surgical management which needs to be corrected. So, identifying the problem plays a very important role in treatment of jaundice. For example, when we are talking about intrahepatic jaundice, it can be because of multiple viruses, infections. It can be because of some medications which we have taken for other diseases, or it can be the most common cause, as all of you know, it can be because of alcohol intoxication. So, intrahepatic jaundice can be multiple reasons. Similarly, when there is a problem with excretion of bile from the liver into the intestine, that means there is a problem in the gallbladder or in the common bile duct. It is a bile pipe which is adjacent to the gallbladder. If there is a problem like stones which get stuck in the bile duct, you can have jaundice. If there is a problem in the pancreas which can cause edema to the bile duct, and it can cause jaundice. So, there are various reasons which can cause jaundice, and these should be identified properly. A single medication for jaundice cannot treat the cause for jaundice. If you are treating fever, you should identify the cause for fever. For example, is it related to malaria? Is it related to dengue? This is how, if there is jaundice, treat it as a symptom and try and identify the background cause. And if you identify the background cause, we will be able to treat this jaundice. So, any patients with yellowish discoloration of eyes or urine or jaundice should be seeing a hepatologist or a liver specialist to identify the cause of your disease and then get your treatment done tailored to the cause of the jaundice. Thank you.